Hi there, my name is Dr. Katrina Cox, and I'm a naturopathic doctor and the author of The Opportunity in Cancer. I wanted to come on and talk about the last topic relating to nutrition today, and this one is about long-term strategies and moving beyond fad diets in terms of making an impact in cancer survivors' life. Nutrition, as we talked about, is a complicated subject. There's a lot to consider. It can be very complex. It's not just calories in, calories out. And a lot of times what I see on social media is people saying things like, let's do body BMI management. That will reduce your risk of cancer. And actually it doesn't. There are lots of studies that show optimizing body composition versus worrying about a BMI is more impactful on cancer reoccurrence. And that's something to consider. It's not just about the weight on the scale, and using that as an indicator of cancer reoccurrence is just really crazy, because there are so many things after cancer treatment that we need to consider. There are some people who lose a ton of weight and need to actually gain weight. There are some people who gain weight just as side effects to treatment. I mean, this happened in the clinic just last week where I had a patient who needed to be on a long-term dose of steroids in order to manage getting through chemotherapy. And because of that lower dose, long-term steroids, she started showing the signs and symptoms of steroid overuse. And so that was required in order to get through her treatment. So she started gaining weight, she started gaining water, she was starting to feel joint stiffness and achiness. She started to experience blood sugar regulation concerns, sleep deprivation was all a part of the picture. And her cancer team that was constantly giving her chemotherapy kept telling her that it was because she was gaining weight. It was her fault that she was gaining weight, and that was all these symptoms. And when she came into my office just before her last chemo treatment, I said, you realize that it's actually the side effect of prednisone and not of something that you're doing wrong. And she just started bawling because she truly believed that it was because she wasn't able to keep her nutrition on point. So in one hand, they were telling her, just eat whatever you can because it's changing your appetite and your taste, and just make sure you get enough calories. Doesn't matter if it comes from ice cream or whatever, just eat whatever. And then on the other hand, they're telling her that it's her own fault that she's gaining all this weight, and that was what all of her problems were related to. And so I actually said to her, we need to throw this out. We need to talk about body composition, and that's how we're going to get you to recover. And that was a huge breakthrough moment for her because it was connected to her journey. And she truly believed that if she wasn't able to lose the weight and find that new reset point, that it was problematic. And so this is where I talk to cancer survivors in terms of moving beyond, these dietary fads and not considering BMI strictly in terms of moving through what it is in terms of making sure you have a long-term strategy for nutrition. So the keys to making sure those 3 N's work is making sure that the 3 F's are adhered to. So your food has to be functional. Can you make it every day? Do you have enough time to connect with it? It doesn't make sense, cutting and pasting and cutting and chopping all these vegetables and juicing them if it's just labor intensive and it's not going to work. So functional food we need. We need the food to be fulfilling. Do you feel satisfied after eating? A lot of times people will be like, I have a sweet tooth. And I said, so have a little dessert after dinner. And they'll be like, oh, but I'm not supposed to. And I'm like, hold on. It would be better for you to fast for that 13 hours and make sure that you finish your diet, your dinner with a little bit of sweet. Pop 2 pieces of little dark chocolate in, and you're going to hit the sweet spot and you'll be super happy. Sometimes I'll do the dishes first, take that 15, 20 minutes, and then I'll be able to tell how full I am, and then I'm fulfilled. I get a little bit of my sweet on, and then I'm ready to move on. And then you also have to have flexibility. Every day is not the same. Do we have every day to stand over the stove in order to make sure that we're making the food that we need? Do we have all of what we need in terms of in our garden and everything else? So making sure our food is functional, flexible, and fulfilling really allows for this long-term strategy of connecting with those 3 N's in nutrition. So my thought process with patients is that weight loss for weight loss sake, which is what I see a lot on social media, is never shown to be good on health outcomes. There are lots of studies which we've referenced in the information below that shows that weight loss for weight loss sake is not good for health outcomes. More importantly, with cancer reoccurrence, I would be very careful about any studies that are being referred to as weight loss being a positive impact on cancer reoccurrence, because a lot of times weight loss, especially at a certain point, is actually showing cancer cachexia, and that actually shows the negative towards those cancer reoccurrences. So more importantly, when we're talking about this, connection with changes in our body and connecting with that new reset point, optimizing body composition is the most important. So one, let's break through diet culture. Let's focus on being nutrition for life. And that means we have to put down those three N's. Our food needs to be natural, it needs to be nurturing, and it needs to be nourishing. Second thing is, for long-term success, we need to have beyond, this part with diet, we need to have this healthy lifestyle choices. And that allows us to have those three F's. Our food needs to be functional, it needs to be flexible, and it needs to be fulfilling. So with all of that, I hope your nutritional journey is full and that you're able to connect with your food again. So remember, join us on cancerremissionmission.com, on our mailing list, and also on our social media channels.